Good afternoon. Thank you for coming back for another pharmacology class. I will be continuing with the drugs altering the hormonal milieu. And today I'm going to deal with two topics, antiandrogen and 5-alpha reductase inhibitor. So I will start off with antiandrogen. Now, under antiandrogen, we have two drugs. We have flutamide and bicalutamide. Flutamide and bicalutamide. Now, what do we know about flutamide? So just have a glance about flutamide. Flutamide, it is non-steroidal drug. The first feature about it is non-steroidal drug. And it has got no other hormonal activity apart from being anti-androgenic. No other hormonal activity other than anti-androgenic property. Now what happens over here is its active metabolite 2-hydroxyflutamide competitively blocks androgen action on accessory sex organs as well as on the pituitary. Its active metabolite 2-hydroxyflutamide competitively blocks androgen action on the accessory sex organs as well as on the pituitary, and when it blocks on the accessory sex organ as well as on the pituitary, it will result in increased luteinizing hormone, in short LH, increased luteinizing hormone secretion. And when this luteinizing hormone secretion gets increased, it produces a blockage in the feedback inhibition. It produces a blockage in the feedback inhibition. Now, if you see in case of the plasma, the testosterone levels will be increased and it will partially overcome the direct anti-androgenic action. And palliative effect can be found in case of metastatic prostatic carcinoma. Metastatic prostatic carcinoma. But there is a criteria if we use it along with gonadotropin releasing hormone agonist. Gonadotropin releasing hormone agonist. The main intention of gonadotropin releasing hormone agonist is to suppress the luteinizing hormone as well as the testosterone secretion. Or we can even go for using it after castration. That means when we remove the testicles from the males after that particular procedure, after the castration, in order to block the residual action of the adrenal androgens. In some cases, they have tried it on females for treating hirsutism along with oral contraceptives. Apart from this, they have tried it out for treating female hirsutism along with oral contraceptives. Though gynecomastia and breast tenderness occur frequently, libido and potency are largely preserved. Reports of liver damage have caused a restriction on its use. So this is about flutamide. Alright, so flutamide, it is anti-androgenic, non-steroidal. It has got no other hormone activity. Its active metabolite, that is 2-hydroxyflutamide, it will go and block the androgen action in the pituitary as well as in the accessory sex organs, thereby increasing the luteinizing hormone, which causes or which blocks a feedback inhibition. The plasma testosterone levels get raised in males and partially overcome the direct anti-androgenic prostate action. And palliative effect can be found in case of metastatic carcinoma prostate. If we use it, it will be better if we use it with gonadotropin releasing hormone agonist. In order to, its main uses, it will be suppressing the luteinizing hormone as well as the testosterone production, and or we can use it after castration in order to block the residual action of the adrenal androgens. In such case, we can use it. In case of females, they have tried out for treating female hirsutism along with oral contraceptives. And the commonly or frequently occurring problems are gynecomastia as well as tenderness in the breast. But libido impotency, those features or those things will be largely preserved. And reports of liver damage have caused its restricted use. Now dose 250 mg, thrice we have to give this particular drug. Moving over to the second drug, bicalutamide. Bicalutamide. Compared to flutamide, this is even more potent, longer acting congener, and it is suitable for once daily administration in case of metastatic carcinoma of prostate. And when we use it along with gonadotropin releasing hormone agonist or following castration, 50 milligrams once in a day provides a marked relief in bone pain and other symptoms due to the metastasis. So this is more potent, longer acting congener than congener of flutamide, and its advantage is once daily administration in case of metastatic prostate carcinoma. And when we use it with gonadotropin releasing hormone or following castration, 50 milligrams once in a day, it provides a symptomatic relief from the bone pain and other symptoms due to the metastasis. Side effects which can be noticed are hot flushes, chills, edema, loose stools. But it is better tolerated and it is less hepatotoxic when compared to flutamide. Flutamide, its use is restricted because of the liver damage, but here it is less hepatotoxic. Elevation of hepatic transaminase above twice normal is a signal for stopping the drug. So it doesn't mean that it is not going to harm the liver. It will harm the liver, but it's going to be in a slow progressive way. So we have to monitor, or we have to continuously check out the liver enzymes. Liver function test has to be carried out, and when we find that the liver enzymes or the hepatic transaminase is being elevated twice normal, then it is a caution for the medical professional to stop the particular drug. So this is about bicalutamide. So with this I have completed anti-androgen. So anti-androgen, these are the drugs which will be provided for altering the hormonal milieu in cancer patients. We have two drugs here, flutamide and bicalutamide. So talking about flutamide, it is non-steroidal, it is anti-androgenic, and does not possess any other hormonal activity. Its active metabolite 2-hydroxyflutamide, it will block the androgen action which will be taking place on the accessory sex organs as well as on the pituitary, thereby increasing the luteinizing hormone, and which will be causing a blocking feedback inhibition. Plasma testosterone levels get raised in males, and it will be partially overcoming the direct anti-androgenic action. Palliative effect can be found in case of metastatic carcinoma prostate, but it will be even more useful, or it can produce a very good benefit when we combine it with the gonadotropin releasing hormone, that is mainly to suppress the luteinizing hormone as well as to bring down the production of testosterone, or following castration in order to block the residual action of the adrenal androgens. And in case of female, once it is combined with oral contraceptives, this can be used to treat female hirsutism. and frequently occurring problems are gynecomastia and breast tenderness, but it has preserved the function of libido as well as the potency, and reports of liver damage has caused its restricted use. Moving over to bicalutamide. Bicalutamide, when compared to flutamide, it is even more potent, and it is a longer acting congener of flutamide, and it is very useful for just a single daily administration. And when we combine it with a gonadotropin releasing hormone agonist or following castration, just we need to administer 50 milligrams once in a day, and that provides a symptomatic relief from bone pain and other symptoms caused by the metastasis. The side effects which we can notice over here is hot flashes, chills, edema, loose stools, but it is better tolerated and less hepatotoxic. But when we find that the liver enzyme, that is hepatic transaminase, it has got doubled or it has got raised twice than normal, then it is a signal to stop the particular drug. And flutamide, we go for administering 250 mg 3 times in a day, and this bicalutamide, just we need to administer once daily. And when we combine it with gonadotropin releasing hormone or after castration, just 50 mg once in a day is more than enough for providing us symptomatic relief. So with this, I have completed anti-androgens. The next class, moving over to the next class that comes under drug altering the hormonal milieu, and that is 5-alpha reductase inhibitor. 5-alpha reductase inhibitor. Now, this consists of two drugs, finasteride, dutasteride. Finasteride and dutasteride. Now, 5-alpha reductase inhibitors like finasteride and dutasteride, they will be inhibiting the conversion of testosterone to dihydrotestosterone in prostate and other tissues. Okay, it will be inhibiting the conversion of testosterone to dihydrotestosterone in prostate and other tissues, and they provide a palliative effect in advanced carcinoma prostate, and it is occasionally used. Okay, so let's see individually what do we mean by, or what are the actions, or what happens when finasteride or dutasteride enters into the body, or what happens or what goes on. Now let's see about finasteride. It is a competitive inhibitor of the enzyme 5-alpha reductase. As we discussed initially, it converts testosterone to dihydrotestosterone in the prostate as well as in the tissues. So this will be inhibiting, or this will be blocking this particular conversion to dihydrotestosterone in the prostate as well as in the other tissues. So let's see what has happened when we have started with the treatment. Now, treatment with finasteride has resulted in decreased prostate size and increased peak urinary flow rate in approximately 50% of the patients with symptomatic benign hypertrophy of prostate. Okay, so two things happens. There are two things which comes under benign hypertrophy of prostate. Now, benign hypertrophy of prostate, two things happens. One is the size of the prostate keeps, or it grows big, and the tone of the bladder neck or the prostate, the smooth muscles mainly, it will be getting increased. Okay, so there will be a much effect taking place on the things. So basically there are two components, one is a static component and one is a dynamic component. So related to the smooth muscles which are getting affected, affecting the tone of the bladder, neck or the prostate, that will be coming under the dynamic component, whereas the size of the prostate will be coming under the static component. So these two components will be considered, and for that the particular drugs will be directed. So usually we will be directing alpha 1 blockers to treat the for treating the dynamic component, whereas the 5-alpha reductase inhibitor will be directed to treat the static component, that is to treat the increased size of the prostate, whereas the dynamic component is related to the tone. The muscle tone has to be reduced. Okay, it has to be increased, so it does not go for, or because of the tone of the muscles which are getting affected because of the increased size of the prostate, what happens is there is a problem for the patient to pass their urine. They may suffer from hesitancy, or they may suffer from dribbling of the urine. So there will be a lot of urinary problems which are faced by this. So keeping that in mind, they will be directing the use of this 5-alpha reductase inhibitors to treat this, or to provide this symptomatic relief. And here I mentioned about alpha 1 blockers which they use in order to provide a symptomatic relief along with 5-alpha reductase inhibitor. So usually they will be using the drug prazosin, and that will be directing the particular dynamic component to be, or to reach back to the normal stage. So usually they get a very good relief within 2 weeks when we use it in combination. Now, withdrawal of the drug. When we withdraw this finasteride, it results in regrowth of the prostate. But with continued therapy, the benefit will be maintained for 3 years or more. So immediate withdrawal, we should not think about it. It has to be done on a gradual basis after continuing for a period of time. The relief of obstructive symptoms, like I said, once the prostate gets increased in size, it's going to cause a lot of obstructive problems. Mainly the urinary obstruction can be noticed over here. So the obstructive symptoms will be less marked when compared to surgery and with the use of alpha 1 blockers. So, and apart from that, it provides us a very good symptomatic relief, which I said that related to the obstructive complaints and related to the size of the prostate. So when these two drugs come in contact with each other, this effect will be produced. Now, apart from that, it is very good in treating male pattern baldness. So what it does is it promotes the hair growth and prevents further hair loss. And usually they have noticed that it takes 3 or more months for the therapy to take place, and the benefit will be reversed within 1 year of the treatment cessation. However, 20 to 30% cases, they do not show any improvement in that particular aspect. Pharmacodynamics, if you see about finasteride, it is effective orally. It gets extensively metabolized in liver, and these metabolites are excreted in urine as well as in feces. Plasma half-life is 4 to 8 hours. In case of elderly, it is 6 to 50 hours. And usually it is very well tolerated by most of the patients. Side effects: increased libido, impotence, decreased volume of ejaculate. Skin rashes and swelling of lips can be noticed here. And the dose which we administer for BHP, that is benign hypertrophy of prostate, is 5 mg once in a day, and a review will be done after 6 months. And for male pattern baldness, 1 milligram per day will be administered. Coming over to dutasteride. This is the second drug which we use under 5-alpha reductase inhibitor. It's a congener of finasteride. It inhibits both type 1 and type 2 5-alpha reductase and reduces the dihydrotestosterone levels. It gets metabolized and it is a very long acting, and the half-life is approximately 9 weeks. Half-life is approximately 9 weeks. It is approved for its use in case of benign hypertrophy of prostate, and is also being tested in baldness and for prevention of prostate carcinoma. And the dose that we go for administering to the patient is 0.5 mg OD. So this is all about 5-alpha reductase inhibitor. Okay, so 5-alpha reductase inhibitor, their main role is to prevent or to inhibit the conversion of testosterone to dihydrotestosterone in prostate as well as in other tissue. And also it behaves as a palliative therapy or as a palliative effect in case of advanced carcinoma prostate, and occasionally they are being used. And we have two drugs over here, finasteride as well as dutasteride. Finasteride, it will be inhibiting the conversion of testosterone into the dihydrotestosterone, and this dihydrotestosterone, these are responsible for carrying out Antiandrogen action in the tissues, including this prostate gland as well as in the hair follicles. Okay, so even what it does is, when we start treating with finasteride, it has caused a reduction in the size of the prostate size. Like I mentioned, it is very vastly used in case of treatment of benign hypertrophy of prostate. And there are basically two components that will be considered under benign hypertrophy of prostate. That is the static component, that is your static component is nothing, that is increased size of the prostate, whereas the dynamic component that will be considered over here is the tone of the bladder neck of the prostate smooth muscles get increased, for which we have to start administering alpha-1 blockers like prazosin along with this 5-alpha reductase inhibitor. Okay, so what it does is this is going to provide a symptomatic relief, okay, by tackling or by reducing or decreasing the size of the prostate, as well as treating the obstruction complaints or the obstruction problems which are caused by the increased prostate. And as a result, the patient gets a very good symptomatic relief. When we go for withdrawal of this drug, it results in regrowth of the prostate. But if we continue with this drug, then the therapy benefit will be lasting for more than 3 years or more. And if you see, it is also found very effective in case of male pattern baldness, and it promotes hair growth and prevents further hair loss. Observable response takes place 3 or more months therapy, and benefit is reversed within 1 year of treatment cessation. However, 20 to 30% cases, they don't show any improvement. If you check out the pharmacokinetics, it is effective very effective when taken orally. It gets extensively metabolized in liver, and the metabolites are excreted in urine as well as in feces, and the plasma half-life is 4 to 8 hours. In case of elderly, it is 6 to 15 hours, and it is very well tolerated by most patients. The side effects noticed over here is decreased libido, impotence, decreased volume of ejaculate, skin rashes, swelling of lips. Okay, so these are the side effects which we can notice over here. The dose that we administer for benign hypertrophy of prostate is 5 milligrams OD, and a review will be carried out after 6 months. And for male pattern baldness, 1 milligrams per day will be administered to the patient. The second drug which is used under 5-alpha reductase is dutasteride. Dutasteride is a congener of finasteride, and it inhibits both type 1 as well as type 2 5-alpha reductase, and it reduces the dihydrotestosterone levels. It is metabolized and it is very long acting, and the half-life is approximately 9 weeks. And it is very well approved for its use in benign hypertrophy of prostate, and is also being tested for baldness and for prevention for prostate of carcinoma. And the dose which we go for administering here is 0.5 mg once in a day. So I hope you have understood about antiandrogens as well as 5-alpha reductase inhibitors. I will be continuing in the next class. Thank you so much for tuning in, and take very good care of yourself. Thank you.